Hey guys, my name is Brenna Posey. I'm an OCD team member. I also have OCD and have gone through exposure response prevention therapy. You may recognize me from our NOCD Instagram page. I run a weekly Instagram Q&A. I love getting to do that because I get to know some of our community members more and get to talk about OCD and my journey and with ERP and OCD. So feel free to join us on our Instagram page weekly on our stories where I get to answer lots of questions. As 2024 is coming to a close, I know a lot of us are taking the time to just reflect. And this year, I was so excited to see that so many of our amazing OCD community members were able to get back to the things that they actually love to do. By getting access to effective treatment for their OCD, a lot of our members were able to achieve things like travel alone for work, or cook meals again, or graduate college and actually laugh sincerely and travel for work. It was so exciting to see people's accomplishments and see what life was like after being able to manage their OCD. But I know whenever you're in the middle of struggling with OCD, it can feel really hard and almost impossible to make a change. Change feels really hard. Getting treatment or just change in general, whenever you're struggling, it feels almost impossible, even if you want to get better. And I know that because I've been there. A few years ago, I was really overwhelmed with my OCD and was just in a bad place mentally. But I was able to find and access evidence based treatment, and it truly changed my life. So now I'm here just to give back to our community and support those that want to take their first step in managing their OCD or who are just curious about what treatment looks like. So as we wrap up 2024 and look towards 2025, some of you might be considering starting OCD treatment in the near year, and I really hope you do. It can be scary, but also it's so worth it. I also know that some of you may just have some questions about starting OCD treatment, so I wanted to take a few minutes and answer three common questions that we get about OCD and about OCD treatment. And those questions are: one, how do I know if I have OCD? Question two, what is the best treatment for OCD? And three, I'm scared to start treatment, so how do I get past that? The first question, how do I know if I have OCD? So, OCD is characterized by one, persistent, unwanted thoughts, images, urges, or feelings, sensations, etc. Two, you're attempting to control the thoughts with rituals. So, these are compulsions, mental or physical. Third is the time spent each day avoiding or preventing thoughts, images, or urges. And a lot of time, it takes a lot of time out of your day. So those that are really struggling may take multiple hours out of their day to fixate on these thoughts and compulsions. And then lastly, thoughts, images, or urges are patterns around or fixated on a particular fear that does not align with who you are and what you know about yourself or the world. Now, a lot of times people get confused because OCD makes it feel like you want to have these thoughts or images. Now, this is just another lie and another trick that OCD loves to play on us. But normally, if you get a lot of anxiety about a thought and just don't want that thought in your brain, then that means that you don't want those thoughts. And these are OCD intrusive thoughts, not what you actually want to be thinking. But a lot of times our OCD says, well, let's just try to get rid of these thoughts. I don't want these thoughts. I don't want these like scary feelings. Let's try to push them out of our brain. And by doing this, we're performing a compulsion. And performing compulsions actually just keeps us stuck in that OCD cycle because whenever we get perform a compulsion, it's a reaction. And so OCD loves getting a reaction out of us because it tells our brain that we should be concerned about this thought. And all of a sudden, we get stuck in that cycle. Second question, what is the best treatment for OCD? And the answer to this question is ERP therapy. And that stands for Exposure Response Prevention Therapy. This is the gold standard treatment for OCD. It's proven to be very successful for a lot of people. Now, I want to talk here for a moment about talk therapy versus specialized OCD treatment. A lot of us that have had anxiety or OCD may have started out with a talk therapist and we didn't know it was a talk therapist, or we didn't know we had OCD, and our therapist may not have been knowledgeable about OCD. And talk therapy, a lot of times, can hinder us and make our OCD worse because in talk therapy, that's whenever we try to analyze our thoughts and try to get to the root of those thoughts to try to determine where these thoughts came from. Did something in childhood make me have these thoughts? Or let's just try to analyze and discover why we're having them. And let's just make it known that we don't want these thoughts. This can cause issues down the road for OCD because we're fixating, we're ruminating, we're actually performing compulsions by doing this. Whereas in specialized OCD treatment or ERP, we're not doing that at all. We're allowing these thoughts and these scary obsessions that we don't like to be in our brain and not perform the compulsions. So instead of analyzing thoughts and wondering why we're having these thoughts in the first place, we're going to allow the thoughts to come in and just recognize that it's a thought and not perform your compulsion. So allow the thought to come in, recognize you're feeling, I don't really like this feeling, but I'm going to sit with it. I'm not going to perform any mental compulsions such as mentally reviewing or trying to push a thought away. I'm not going to do any of that. I'm going to sit with the anxiety and discomfort and then just let the thought flow out of my brain. And this sounds scary because you're truly letting yourself be exposed to your biggest fear. So it takes time and practice and guidance and a lot of self-compassion, but you can do it. Once you get a small win and start ERP therapy, those wins just keep on building on top of one another. And you'll be able to do this outside of therapy, even, and just in real life, being able to allow these triggers to be there and not avoid triggers. The last question is, I'm scared to start treatment. How do I get past that? I completely understand and want to validate your feelings right here because getting started with therapy can feel really, really scary. And, you've been kind of operating a certain way for a long time before therapy, right? You've been having your obsessions, you've been performing your compulsions, you find that relief for a split second, and then the OCD obsession comes back and you do it all again. And who knows how long you've been doing this for? Your brain has been in this cycle for a long time. So introducing something new to your brain can feel like a shock to your system. So I totally understand that. But sometimes the best way to handle OCD is by trying something different, even if it means taking that risk of, I don't know if these thoughts are real or not, but I'm going to take that risk because I need to do something different to improve my quality of life. We don't want OCD to dictate how we want to live our life. We want to be able to cook meals, to travel alone, to laugh and feel things sincerely, to be in a relationship, to do the things that you want to do without having OCD tell you how to live in a certain way or to avoid people, avoid situations. We don't want to live like that. That restricts our life. And by doing ERP therapy, your life just expands and your life broadens. But taking that risk can feel scary. I know that. It's so worth it once you look back and notice how big and beautiful and full your life is. So if you are listening to this and you feel encouraged to maybe take that first step in trying something different and to try specialized therapy or ERP therapy for your OCD, I truly encourage you to do that and to take that first step. So please go to NOCD.com and book a free call with our team. They are so excited to talk to you and so excited to talk about NOCD and ERP and can get you matched with a licensed therapist in our network in your area who can provide you these skills and guidance in your OCD therapy.